So I grew up in the Great Lakes Bay region and was fortunate enough that my parents were married, stayed married. We lived in a single household. Both my parents were working. I had a pretty easy, traditional childhood, and decided that I wanted to pursue medicine. Actually, I thought I wanted to be a veterinarian, but I think I would have ended up with a house full of animals because I would have wanted to save them all. So at some point, my mother's a nurse, and I decided that I was going to help people instead of animals, and kind of got into this track of going into medical school. And I think that's kind of where my story starts. As a child, I was really carefree. I kind of got in trouble sometimes for being a social butterfly, and for I probably had undiagnosed ADHD, and they just didn't really treat it as much back then. And then I noticed that my brother, when he was accepted to college, just how much pride that brought to our family, and how much adults responded to that big achievement. And so decided that I was going to take care of people, and that I was going to go into medical school. And for me, that's where things changed significantly. And I transitioned from a carefree, happy, easygoing kid to a much more driven person, because I could see, and I liked the feedback, I liked the attention that I got when I achieved things. And so I slowly found myself pursuing things based on what I was being told to pursue. So, meeting with counselors, and these are the classes that you need to get in to go to college. These are the classes and the extracurricular things, the volunteer activities that you need to complete to beef up your resume. And that was just the life that I started leading, was one that wasn't necessarily led by my heart, by my dreams, but by what I thought I was supposed to be doing to get to this ultimate goal. And I'm a 14, 15-year-old girl who's making this big, profound decision, and then just kind of letting it lead me along the way. And that's really what started to feel like was happening as I got into college, is that I was on this track that just had so much steam behind it that there was no way for me to pump the brakes or to do anything else. And so once the momentum got going, and I had the support, and this was my announced dream, and I'm applying for medical school, and I'm studying for MCATs, and trying to get in, that was it. There was no really room, and it wasn't really acceptable to make a big change. Once you've decided that you're going to do something prestigious and well respected, it is a big red flag, and it's not really looked at by the community or by family members as a positive thing when you decide, like, maybe this isn't me, like maybe this isn't exactly what I want to do. And so I found that through undergrad 4 years, and medical school 4 years, and then getting into residency, which is another 4 years, I was on this track that I just couldn't stop. And I was great at it. I succeeded in everything I did. I was in honors, the Alpha Omega Alpha, which is like a medical society, like top 20% of medical students in the country. Admitted to MD Anderson, which is like the top research fellowship for GYN oncology in the country. And then my life just kind of fell apart. And I didn't know how to make the train stop, so I kind of self-sabotaged myself. I got to a point where I was so angry with myself and so frustrated with who I had become that I projected that on everyone else. And so I was a person that people didn't really want to be around. I wasn't this kind, happy, helpful, bubbly person that I knew I was, when I was a child. My husband has been with me since high school, and so it's been interesting to watch his assessment of me, because he kind of met me in the beginning of this before really things took a change, and before I really started to be consumed with this achievement mindset. And he just describes how I want the old Shawna back, or like, why can't we do things the way that we used to? And so in residency, I kind of had a big moment where things kind of fell apart all around me, and I made a decision to actually take a leave of absence for my residency, just for my mental health, because I didn't want to live anymore. I didn't want to, it wasn't even I didn't want to be a physician, I just didn't want to be a person anymore. Like, I just didn't have any happiness with my existence. And so I was suicidal. I got help, not intentionally. I got help because I made problems for myself. But that was the help that I needed to be able to kind of admit to people that I wasn't myself and I wasn't happy, and that I wasn't this high achieving person that everybody on the outside was seeing. So I took a leave of absence and moved home. We were living out of state at the time. We moved home, and I found out I was pregnant with my firstborn, and we gave her a middle name of Grace, just because I think that was exactly what I needed during that time, is just to have a little bit of grace and understanding that it's okay if I am not going to be what I think everybody else wants me to be. And just having some time to kind of reevaluate and be with counselors and start medication and doing therapy really helped me to kind of reassess and try to go back to, like, what do I really want? I still felt that I was being pushed in a direction because I was so in debt and so highly trained at this point that it didn't really feel like there was another option for me. So I did end up pursuing and finishing my residency training and getting my board certification, and then ultimately returning back to Michigan to start a practice or to join a practice. And that's been good. There's been times where it's been easy to go back into those same tendencies of thinking, I need to do it this way. This is what the partners before me have done. This is what the physicians before me have done. This is what the expectation is. And whenever I go back into those tendencies, I get those same thoughts of, I get unhappy with what I'm doing. And I think one of the biggest things from my story that I would want people to take away is that you don't have to do what other people expect of you, that it's much more important to listen to kind of what you feel inside. Even now, there's times where I think, well, maybe I won't practice medicine for 10 or 15 or 20 years. Maybe this isn't what's meant for me. Maybe there's something more. My heart's always wanted to be in advocacy and to affect more people. And sometimes I wonder, is an individual patient really what my scope is, or is there a bigger message out there for me to be able to share? And it's difficult. There's still lots of tendencies for me to say, like, well, why would I do anything differently? I have this great job. I have an awesome career. My patients love me. My family's amazing. I have 3 healthy young girls. Like, everything's perfect. We have a great house, an awesome neighborhood. Everything's going just the way it should. But is this it for me? Or do I need to, sell everything, move, and go work in a third world country? I don't know. But just to know that I have that option, and that I've shaken up my life once before, and that the pressure from society and culture to fit in a box and to do what you would expect of a physician, how they live, it's not always going to be the answer for you. And I found that continued coaching, life coaching and therapy, having friends that I can be myself with, have kind of made all the difference. And I think about my daughters, and I think about the impact that I want to have on them. I think about the future, and I think about how I felt at times, and not anyone's fault, not my parents' fault, not school counselors' fault, just the train tracks that we all kind of find ourselves on. And I want to avoid that. So I'm conscious about that when I talk to my patients. I'm conscious about that when I talk to my employees, my staff, and my friends, and my children. I want them to know that they can make a mistake, that they can change their mind, that we can pivot. I think we talk about and we think about, well, what's the worst thing that's going to happen? Oh my gosh, you could lose your job, you could lose your house, you could get a divorce. You'll figure it out. I think we're so afraid of the unknown and the uncertainty that you instead jump into this track, and you jump into this life that you make a decision when you're 13 or 14 years old. I'm going to be a doctor. And then that just sets everything in motion. And I think we just get so afraid to decide that we want to take a different route and shake things up a little bit. So for me, I think my mental health story really involves feeling the pressure from culture, society, the community to kind of stay on this track that I had picked that seemed to be so prestigious and seemed to be, a sought after career, and then discovering that maybe there's something else out there for me, and shaking that up is sometimes a little scary.